Hey guys, I'm Sebastian at Performance Play Sports Care in Huntington Beach. I'm going to cover the spine for you today, in this case the lower spine, and I'm going to help you through a lot of the questions you might have had for your doctor about what's causing your back pain. And I know people do have a lot of questions about what structure it is, maybe how they would feel it, what symptoms they might experience, and if there's anything really serious going on, because a lot of times the fear of just not knowing if you have a clean bill of health is a very frightening thing. And so a lot of times in our appointments, we don't have time to go through everything with you, all the nuances of the spine, and probably your doctors don't as well. And so I hope this video serves as a good way for you to understand all the little bits and pieces that might be going on. I hope too in this video that you understand that most of you will get better. You can get better. It will not take years and months to get better. A lot of times it just takes weeks to months. You just have to get the right solution to your problem. And if you think you've tried everything, you probably haven't. So figure out the thing that you're not trying yet, which I can give you suggestions a little later in the video. I'll show you one of my favorite first aids to do for generalized low back pain. And just try it. And if it works, then you know that there's a solution that is going to work for you. You just haven't found it yet. So I'm going to use this spine here, and I might interchange spines a couple of times just so you guys can get a good visualization of what's going on. But a lot of things you might have heard about in regards to lower back pain, and I'll give you some locations in a little bit. I don't have a camera in today, so I'm going to do my best to get camera angles. You might have heard about the low back disc. Let's make sure we focus there. So here's the low back disc right in there. There's one of them. There's multiples. There's the vertebral bodies. Sometimes people say there's been fractures and things like that. And then there's the nerve roots, which is another common reason for lower back pain. And then there's the little joints in back here. These are, you can see a little space there. It's called the facet. Most of the time, these areas are the ones that are the higher probabilities of lower back pain. Also, too, you might have heard of stenosis. Stenosis is a little bit tougher to understand on this model, so I'll get another. Stenosis, which it sounds like a really scary term, but it really just means narrowing. And narrowing can happen anywhere. And so if you look here, this is the spine looking from like a downward, like straight down from the sky down your head type of thing. There's this spinal cord, and then there's the canal. There's the canal in the middle. And the canals, let's just say the canal is this big, and then the cord is this big. And sometimes when people have some more advanced arthritic conditions or even other types of occlusions to this canal, it'll create some narrowing. And that narrowing can happen from a couple different things. But if the narrowing occurs, sometimes you get symptoms into the back and even into the legs. There's also something called foraminal stenosis, which is the side here. These are the foramen that the nerves go through. You see those little holes, and I'll just open the foramen and close the foramen. Open the foramen, close the foramen. This too can you can get some narrowing of this area too. Again, it can happen from multiple things, but for the most part, sometimes you'll get some leg pain or even numbness, tingling, change of sensation to the foot, leg, thigh, even groin, based upon if you have some encroachment right into here. A lot of times you'll find this through MRIs, but let me be very clear. Most of you do not need an X-ray nor an MRI to start care for your back. That's a common misconception people have. You do not need it, mainly because you can get a lot of information about what's going on through a really detailed physical exam, which is just people like me just putting their hands on you and stress testing your spine. Here's what we know with, I'll bring the big spine up, at least with this. Here's what kind of a physical exam could look like in regards to stress testing the spine. And again, you don't need a fancy machine to do this. Let's just say we're trying to stress test the front side of the spine here. I could have you bend forward and have you load the front of the spine here, like I'm compressing down. And what this will do is this will stress test the anterior or front side aspect of the spine. Now, what includes in the front side aspect of the spine? Well, it's basically the whole and forward. And so you look at the disc, we're looking at the vertebral bodies, the bone right there. And if we're looking at the whole and backwards, we might bring you backwards, have you arch military style, and then compress the spine a little bit too. And so we can also do this with bend and to change hole sizes and stuff like that. I know someone's going to say you can't change a hole size. Yes, you can. The holes are dynamic. They move. They open and close based upon position. And a lot of times this is why people have more pain with bending forward, more pain with leaning to one side, or referred symptoms go into the leg, or sciatica starts when leaning to one side, or bending forward or bending backwards. And what we figure out here is what is your spine like and what it doesn't like. Now, let me give you a brief overview of typically what symptom patterns you'll usually find with people with these different types of problems, okay? With a lumbar disc herniation, I'll just back the camera up just so you can take a peek at my movements. A lot of times with the lumbar disc herniation, we're going to find that people don't generally like to bend forward. It's usually worse in the morning time. Let's see, am I far enough away here? It's usually worse in the morning time. The first hour of the day, people usually have a little bit of an issue. And so usually bending forward to tie the shoes, twisting is bothersome. It usually hurts right around kind of like the base of the back right here. You might kind of look into the like palpation points where you find the crest of the hips here, and then you move all the way down to where you found the little bony areas. It could just feel like it's right across that area, and it could move out into the flanks. Yes, it could move into the leg as well. So what we'll find here is that these people usually don't like bending forward, or they'll wake up with the inability to bend forward, and it starts to settle itself throughout the day. But the cool thing is eventually this will go away, but bending backwards is pretty clear. And a lot of times people with a disc issue, again, there's lots of types of disc issues, they'll find themselves going like this to feel better. I think a lot of us just kind of generally know inherently what makes us feel better. And a lot of times in a situation where there's a disc, this will tend to feel better. Even if it's the most intense pain in the world, usually it'll decrease it by a little bit. Now, there's lots of other characteristics of disc problems. That's just one of them for the low back. Now, if we're looking at things like a nerve, which could be like a sciatica, and usually sciatica is from the center of the spine, like I mentioned, that little hole, or the nerve root. These little nerve roots here, right around there, okay? And this could be any of them. Usually what happens here, and I'm going to grab a separate model, is when these things are irritated, we have something called neural tension. Nerves that are irritated, they become sensitive to stretch. They don't like being stretched. And so what we'll find here, and I'll just put it up to my head because it's still part of the spinal cord, but it goes all the way down the leg. And let's just say if I have some low back pain, especially on the left, and I have some thigh issues, some hamstring tightness, some calf tightness, maybe some foot. This person might wake up in the morning, bend forward, they're like, nope, not good. Hey, that's better. And if you look at what's happening here with the nerve, is it's on full stretch when the knees are extended, but the back is rounded, okay? If I round my lower back, a lot of times this is okay for these people, but if I bend the knees, that's dramatically better. Again, not the perfect test for things, but it is a common symptom we find. And we find this more with people who have it on the right side, more with driving, because the knee is kind of in that extended position. And so if I'm going to simulate driving here, this is my right leg if I'm in America, and so I'm looking down the road and then I'm like this, okay? A lot of times bringing the toes up is actually very bothersome because this nerve goes all the way down and this stretches it. If it goes behind the ankle, right around there. Let's just say that. So this stretches it. Anytime you stretch the nerve, it'll light you up, okay? So what we have a lot of people do in this situation is simply bring their chair closer so they're a little bit more knee bent when they're in that position. Now, those are the two major ones. The disc and the nerve are the most common things that we see with people. I'm going to venture to say about 9 out of 10 people have one of those, and they just have to find an easy way to resolve it. Do you need surgery or medications or injections or PRPs for these things? No, most people don't. Those are extreme cases, and there's what we call red flags, where usually you're tripping on objects, you have change of bowel and bladder function, and there's numbness between your legs. Those are things where a little bit more of the big bad scaries, and those might need surgical intervention. But for the most part, pain is not an indication for surgery. In pain management, injections, and that nature, we can do pain management in a different way here by putting you in a position that's comfortable. We're not going to inject you or give you medication because that's not what we do, nor do we think it's really necessary in most people's cases. And I'll show you a video and an exercise in a little bit which will help out with a lot of these types of conditions. Now those two are the bulk of it, but I am going to show you the nitty-gritty things, the SI joint and the facet. So the facets, again, we mentioned them earlier. Okay, the facets are these little things right here. There's a lot of them. They're the things that when you get adjusted, they kind of pop. All right. There's also the SI joint here. There's two of them. Okay. And you can see them from the front side. They're the in the junction between the blue, I think, I'm colorblind, and the white. And so there's two of them. Many times people do have pain in these locations, but they do not have a problem with these structures. That's an important part to understand here. Just because you have pain in a location doesn't mean that you will have, that is the reason for your pain. So most of the time people are 9 out of 10. I have a saying I think is pretty good. Don't chase unicorns, okay? Assume you are a 9 out of 10 person with the nerve or the disc before you actually move forward to the oddball ones. So a lot of times people with facet issues will have problems bending backwards. Bending backwards is bothersome with them. You'll notice that they actually have a lot of stiffness to their back. Not because they can't bend forward, it's just because that's how their body naturally moves. And also doing things like reaching and looking over, like if I'm looking at my other ankle, that will also be bothersome to them too. Walking is typically bothersome because it's an extended activity. Deadlifting can be bothersome as well, but deadlifting can also be bothersome in the disc people because they have a rounded mechanics to them. It's just poor mechanics. The SI joint is a unique one. And so usually there's something called a split squat, which is something that might aggravate symptoms on these people, but and walking too, because those are the only things that shear the SI joint. And I mentioned earlier about stress testing the spine. Stress testing is something that someone like me can do with you. And a lot of the activities that bother you will stress the structure that is the pain generator. And so they have to make sense. And so if you came in and you said that, hey, I have a facet issue, but then bending forward is painful, that's probably not good. That doesn't really stress the facet too much. And so there's specific activities and tests that you can do that actually will give us light to kind of link all the pieces together. We're basically creating a puzzle. And we're figuring out where all the information lies. If it looks like you look more like a disc issue or a facet or a nerve, then we treat you accordingly, and that's just kind of it. Now, let me show you that split squat here because you're probably going to wonder, what the heck is that? A split squat is this thing, okay? This is really one of the major things that we see that people with SI joint problems that have pain with movement or I guess they'd be lunging for you, lunging and walking, but those can also be painful in the other activities as well, so it's not really